Hisar Foundation and Engro Foundation, in association with TV1, NewsOne, Wakeup and FM 91, presents the 5th Karachi International Water Conference webinar series on climate change and pandemic impact on water.
Good afternoon and Assalamu alaikum, ladies and gentlemen and a lot of young friends. I'm Simi Kamal, Chairperson of Hisar Foundation, and I welcome you to the 5th Karachi International Water Conference, which is being held this year as a webinar series on climate change and pandemic impact on water. Today is webinar 3 in this series of 4, which is Thinking the Unthinkable, Harnessing the Pandemic to Improve SDG 6 Health and Sanitation. Before we go into this webinar, let me take a few minutes to introduce you to Hisar Foundation. As many of you know, Hisar Foundation is a foundation for water, food and livelihood security. And we were talking about these different aspects of security when this was set up in 2003, when water security in people's minds only meant the fight with India. So it's a thought leader and innovator. Hisar Foundation is led by a group of dedicated professionals and thinkers who care about water. It has been around for 18 years, and in these 18 years, we are building water security in terms of having a think tank on the rational use of water, a Universities for Water network, series of implementations on the ground, and last but not least, our biggest program to date, which is the Panjwani Hisar Water Institute. So the Karachi International Water Conference is one of Hisar Foundation's flagship operations. It was started in 2013 and it has been convened every 2 years. In 2013, our conference was on water cooperation in action from global to grassroots. 2015, we talked about securing sustainable water for all, integration, inclusion and innovation. In 2017, we spoke on the future of water. In 2019, we deliberated on the water, energy, food nexus, the agenda for the 21st century. And now, in 2021, we are looking at water and climate change action now, our webinar series. This 5th Karachi International Water Conference is a series of 4 webinars instead of in-person conference in deference to COVID. It's on climate change and pandemic impact on water. This time we are trying something new, reaching out to you from a TV studio through the good offices of our sponsor Airwaves Media, whose moving spirit Seema Tahir Khan will also join us later today. There are 4 topics in this webinar series: Code Red for Humanity, Climate Action Now, already done; Circular Water Economy in the Urban Context, this has already been done; today, Thinking the Unthinkable, Harnessing the Pandemic to Improve SDG 6, Health and Sanitation; and the 4th one soon coming up is on water and climate change, Re-imaging Women's Leadership. So in the first one, we discussed the impacts of the unprecedented climate change and adaptation measures to cope with anthropogenic climate change. In the second webinar on circular water economy in urban context, we shared experiences and strategies for policymakers to improve delivery of water supply and sanitation services in a more sustainable, inclusive, efficient and resilient ways.
अस्सलाम वालेकुम, मैं हूं सिमी कमाल, चेयरपर्सन हिसार फाउंडेशन। मैं आप सबको आज के सेशन में खुशामदीद कहती हूं। आज का हमारा वेबिनार 4 में से तीसरा है, जिसका उन्वान है नाकाबिले तसव्वुर का तसव्वुर, SDG 6, सेहत सफाई को बेहतर बनाने के लिए वबा से हासिल किए गए असबाक का इस्तेमाल। आगे पढ़ने से पहले मैं आपका तारुफ हिसार फाउंडेशन से कराती हूँ। ये तंजीम पानी, खुराक और लोगों की रोजी की हिफाजत पर काम करती है। 2003 में जब हमने ये तंजीम कायम की तो लोग पानी के मसाइल को सिर्फ इंडिया की हद तक जानते थे। हिसार फाउंडेशन मजबूत सोच को बुरोकार लाते हुए जदीद और मुनफरिद अंदाज में काम करती है। इसको चलाने वाले लोग और रहनुमा पानी को अपनी अव्वलीन तरजीह समझते हैं। इस वेबिनार में कई और इदारों की मावनत शामिल है, जिसमें एयरवेव मीडिया, WWF, IWMI, पाकिस्तान, एंग्रो हैं।
We'll invite our first keynote speaker, Professor Shehbaz Khan. Professor Shehbaz Khan is the Director of UNESCO Office in Beijing and UNESCO representative to the Democratic People of Republic of Korea, Japan, Mongolia, and People's Republic of China and Republic of Korea.
हमारे पहले मेहमान हैं डॉक्टर शहबाज खान। डॉक्टर शहबाज खान यूनेस्को बीजिंग के डायरेक्टर हैं और जापान, मंगोलिया, चाइना और कोरिया की नुमाइंदगी करते हैं।
Thank you very much. Thank you to Hisar Foundation and Dr. Simi Kamal, and good to see all friends here. So let me share my screen if I am successful. So I would like to present to you these two figures which may not be so legible on your screen. One is about annual baseline water stress. This work is very interesting and it really highlights that we have a very high level of water stress in many parts of the world, and I'm sure you will agree with me. Also, very importantly, before COVID-19, when we were thinking about SDG 6 and its progress, SDG 6 1.1 in terms of drinking water, even before COVID-19, there were serious issues with respect to availability of safely managed water. Water, if you drink, you will be sure you will live, but there are many places where we drink water and at your own risk. So there are serious challenges which were there in terms of the water service level. And this has really, the social inequalities and the availability of water has become even a bigger issue. So these are some of the numbers from WHO, the UNESCO sister organizations, and UNICEF 2017. There are 2.1 billion people who lack safely managed drinking water. When we say safely managed drinking water, there should be no E. coli, there should be no heavy metals, and the water should be safe from the point of view of human health. SDG 6 is certainly was lagging. And the wash element of that was one of the worst ones in terms of our progress. But now really, this COVID-19 has brought a new dimension. How do we bring DNA, RNA from the pathogens? So this is an element which is lacking in most of our water cycle monitoring and evaluation system. So this is an interesting paper by Sims and Hodren from 2020, very interesting paper if you're interested in this area. From the point of view of exposures to pathogens in cities, how do this moves into the sewage treatment plants, what kind of samples we need, how do we then combine BOD, COD, temperature, pH, flow rates, metal concentration, and especially with the pathogenic DNA, RNA. So there is a lot more work which needs to be done. Is this only for the developed countries like Australia, for America, for countries such as in the Europe? My analysis on this is no. We need to promote these areas in the developing countries at the same time. We need to bring our scientists, engineers, our university academics and private sector to work together to create new ways of looking into water, wastewater, wastewater-based epidemiology. So these are new areas, and together we will make a big difference. You are welcome to link with me through LinkedIn or Twitter, and I will be happy to answer any questions in the end if there would be time.
बहुत बहुत शुक्रिया सबका और बहुत शुक्रिया मोहतरमा सिमी कमाल साहिबा। आप सबको यहाँ देखकर बहुत खुशी हुई। मैं यहाँ दो बातें करना चाहूँगा। पहला है वो इलाके जो पानी के दबाव का शिकार हैं। ये काम बहुत दिलचस्प है, जैसा कि आप स्क्रीन पर देख सकते हैं। यकीनन आप इससे मुत्तफिक भी होंगे कि दुनिया का बड़ा हिस्सा पानी की शदीद किल्लत का शिकार है। कोविड-19 से पहले भी जब हमने SDG 611 के हवाले से बात की थी तो इस वक्त भी बहुत बड़ी आबादी पीने के साफ पानी की कमी का शिकार थी। जो पानी आप पीते हैं आपको लगता होगा कि वो आपकी जिंदगी है, मगर बहुत सी जगह ऐसी भी हैं जहां पानी का पीना खतरे से खाली नहीं। पानी की फरहमी और मौजूदगी एक संगीन मसला बन चुका है। हमारे पास यहाँ कुछ एदाद शुमार मौजूद हैं। यूनेस्को और WHO के मुश्तरका ताउन से 2017 में बनाए गए हैं। इसके मुताबिक तकरीबन 21 मिलियन अफराद महफूज पीने के पानी से महरूम है। जब हम महफूज पानी की बात करते हैं तो हमारा मकसद होता है पानी हर किस्म के गैर महफूज अज्जा से पाक हो और इंसानी सेहत के लिए मुफीद हो। अब कोविड-19 ने हमें एक नई सिमत की तरफ गामजन कर दिया है। कुछ ऐसे अनासिर हैं जो हमारे आबी दायराकार से गायब हैं। हम पैथोजेनिस से DNA और RNA अनासिर को कैसे हासिल करें जो कि हमारे ज़्यादातर आबी दायराकार से खारिज हैं। यहाँ एक बहुत दिलचस्प पेपर है। अगर आपको इस मौजू में दिलचस्पी है तो ये पेपर सिम्स एंड हेडन ने 2020 में शाया किया। इसमें एक्सपोजर से पैथोजेनियस से कैसे शहरी इलाकों में आते हैं और फिर कैसे ट्रीटमेंट प्लांट्स में जाते हैं और फिर इनमें SOD COD दर्जा हरारत कैसे शामिल किया जाता है, इनका pH लेवल, धाती हिरासत, फ्लोरेट्स की शमूलियत, बिलखुसूस पैथोजेनियस DNA RNA में इनकी शमूलियत, ये तरक्की याफ्ता ममालिक जैसे कि ऑस्ट्रेलिया, यूरोप, अमेरिका के लिए हैं। मगर हमें यहाँ अपने लोगों को, अपने इंजीनियर्स, यूनिवर्सिटी तलबा और सियासतदानों को आगे लाने की ज़रूरत है ताकि मिलकर आबी आलूदगी की रोकथाम और आबी तहफ़्फ़ुज़ के लिए काम कर सकें।
Good morning, good afternoon, everyone. I hope you are doing well. Let me share quickly my screen and go on with the presentation. So let me go on a presentation mode to make it easier for you to see. So once again, a real pleasure to be here with you and to talk to you about this topic. It's a very important one, and I'm very happy to be coming after Dr. Shabazz, who has really set the stage and presented the background issues that will hopefully take on continuing the discussion in a moment. But before I go into that, I just want to take a minute to talk about the CGIAR, because IMI has an organization, is a member of the CGIAR. Actually, it's a network of research centers. Sorry, there are a number of things that are showing on my screen. It's a bit disturbing. The CGIAR is a global research partnership. So the whole network of organizations are looking at issues such as poverty reduction, enhancing food and nutrition security, making sure that we address issues with management of natural resources. So as an organization, we work, I would say, in over 75 countries. We have representations. We are working with a wide range of partners, of course, academics, NGOs, CSOs, and name it, a number of organizations, research centers, and so on. And we are present in, as you can see on this map, these are where the headquarters of the different centers that are part of the CGIAR are located. And as I said, I'm coming from the International Water Management Institute, and our mission as an organization is to work towards a water secure world. So going now into the subject, I want to take this subject and to present it to you in a structured way. I will start with the SDG targets, just building on what my predecessor has mentioned, what are those targets and what are the baseline, where we stand at the moment, especially focusing on the region that we are interested in South Asia and also Asia as a broad region. We want then to move into what kind of solutions can help us build back better, and some of these elements have been touched upon in the previous presentation. I'll try and pick them up and continue around that. And then I'll conclude my presentation by really emphasizing the need for collaboration, because it is obvious that without collaboration, it won't be possible to achieve the kind of targets, the kind of ambitious targets that we have when it comes to achieving the targets of SDG 6. So let's start from the beginning. SDG 6 is one of the 17 SDGs, Sustainable Development Goals, that have been adopted early. Let's say, we have been enforcing them, or at least working towards their implementation since 2016, so a couple of years ago. This particular goal has 6 targets and 2 sub-targets. And overall, 9 indicators are being used to monitor the progress that is being achieved under this SDG 6. And some of these indicators were presented in the previous presentation. Globally, and this has been mentioned already, a number of countries, quite a large number of countries, are not on track when it comes to the target. And many countries will not, at this pace, will not be able to confirm that they are able to achieve sustainable management of water resources by the 2030 target that we know. And for that, to that, there are a number of reasons. There are factors that are causing that, and we'll look into them in the details. But let's go into more details, more specifics on these numbers. So these are the statistics for 2020. 26% of the global population doesn't have access to safely managed drinking water. And this, if you look at the South Asia region, this is mostly happening in the rural areas where now we are talking about 8 in 10 people who do not necessarily have access to safe water. When it goes to sanitation, we are talking about 46% of the global population that does not have access to proper sanitation. And finally, hygiene, still not available for 29% of the population. So these issues that we know already, they cascade into other SDGs. So they have an impact on many other SDGs like poverty, like gender equality, and also climate change. But then we have to also deal with other issues. And I heard at the beginning, Ms. Simi Kamal mentioned that, the next conference is going to talk about climate change. And climate change indeed is important. But before I talk about it, let's touch on urbanization. So urbanization is a threat for water. It's going to lead into an increase in the water demand. Many sectors, be it domestic, agricultural or industrial, water demand will increase as a result of that. And it means that we need to find more solutions to proactively ensure that water is distributed fairly among all the sectors. So resources will become much more scarce in the context that the region already is in a way already scarce in terms of water availability. And then the climate change, the impacts that are expected. Higher temperatures, a rise in the sea level, extreme weather events, so droughts on the one hand, floods on the other hand. All of this we know has an impact on natural and capital and physical assets. It has an impact on, other issues like poverty. It can destroy resources, reduce food availability, and affect public health. So these are issues that we need to also keep in mind. It's not only about COVID, but there are also other issues, like I said, the urbanization, the climate change, that we also need to bring into the perspective if you want to accelerate the achieving of the SDG 6. So what is the solution that I am proposing? Of course, I understand that there is not a single solution that can address all the problems that we have discussed. But I want to go back to something that was said, has been discussed in the previous conference, which was the need for building local circular economy principles into the practices that we have at the moment. And this, I believe, can really bring in a number of positive elements that can help in the building back better efforts to make sure that there is more sustainability in the implementation of a number of measures. So collaboration. So collaboration is extremely key, and it's only through collaboration that we are going to accelerate the transformation for this SDG 6 targets. And this paper actually has been published. It's a framework that has been released recently, and I think it's a very interesting one. This SDG acceleration framework, it comes with 5 key elements that have to be taken into account for the issues to really be tackled. And the first one is on data and information, making sure that we have enough data and sufficient information to inform the issues and to address the issues, financing and supporting governance, innovation to address the issues in a very effective way. And finally, capacity development. So we understand that capacity development is needed if you want to accelerate SDG 6 in the context of this COVID-19 pandemic. So this report has been published by the UN Water, and I do encourage you to have a look at it because this framework is very interesting. So it can really help address the issues. It can help, I would say, understand the COVID-19 impact and really drive the implementation of SDG 6. moving into, yes, the next slide. Sorry, it's taking a bit of time. Yes, linking with other sectors is also very important. Like I said, the pandemic has had different impacts. The impacts have been, quite mixed. Some were positive, others were less positive. But then we understand now that it's, we need to move forward. We need to find a way to integrate all these issues into the picture, to consider all the limits, all the opportunities, and to drive and to design something that is much stronger for the future. So I wish to thank you all very much for your attention and also for giving me the opportunity to talk about this subject. Thank you.
डॉक्टर जोज़ेन नकीमा, आप सबको मेरी तरफ से शाम बखैर। मुझे इस प्रोग्राम में शिरकत करके बहुत खुशी महसूस हो रही है। ये एक बहुत अहम मौजू है और मुझे उम्मीद है कि डॉक्टर शहबाज ने जिस तरह इस मौजू पर रोशनी डाली है, मैं इसे आगे बढ़ा सकूं और इस पर बात कर सकूं। लेकिन आगे बढ़ने से पहले मैं यहाँ CGIAR के हवाले से बात करना चाहूँगी, जो कि आप इस वक्त स्क्रीन पर देख सकते हैं। CGIAR एक मुश्तरका आलमी तहकीकी इदारा है जो कि गुर्बत के खात्मे, खुराक की बहाली और ग़िज़ाई तहफ़्फ़ुज़ और कुदरती वसाइल को बेहतर बनाने के लिए सरगर्म अमल है। ये इदारा 75 से ज़ायद तरक्की पजीर ममालिक में 3000 से ज़ायद शराकतदारों के साथ काम कर रहा है, जिनमें NGOs, CSOs, तालीमी और तहकीकी इदारे शामिल हैं। और जैसा कि मैंने बताया कि मैं IWMI से आई हूँ, हमारे इदारे का मकसद दुनिया में आबी तहफ़्फ़ुज़ को यकीनी बनाना है। लिहाजा मौजू की तरफ आते हैं। SDG 6 के अहदाफ और बुनियाद के बारे में बात करूंगी। ना सिर्फ एशिया बल्कि दूसरे खित्तों में कैसे इनको बेहतर बनाने के लिए हल निकाले जा सकते हैं, और आखिर में इन तमाम अवामिल में तब्दीली को तेज़ करने के लिए बहामी ताउन पर बात होगी, क्योंकि बहामी ताउन के बगैर हम इस मसले का हल नहीं निकाल सकेंगे। तो शुरू करते हैं SDG 6 के अहदाफ और बुनियाद से। SDG 6 के कुल 6 अहदाफ हैं, 2 ज़ेली अहदाफ और 9 इशारे हैं जो कि इस पर सेशन में शामिल हैं। SDG 6 का मकसद सबके लिए पानी की फरहमी को यकीनी बनाना है, लेकिन अभी भी बहुत से ममालिक ऐसे हैं जहां इन अहदाफ को हासिल करने के आगाज़ में बल्कि तकरीबन 129 ममालिक हैं। यहाँ पायदार मुनज़्ज़म आबी वसाइल के हदफ को हासिल करना 2030 तक बहुत मुश्किल नज़र आता है। इसकी बहुत सी वजूहात हैं। आइए इन वजूहात का तफसीली जायज़ा लेते हैं। 2020 में की गई एक तहकीक के मुताबिक 26% आबादी को साफ़ पीने का पानी मुयस्सर नहीं। बिलखुसूस अगर हम साउथ एशिया की बात करें तो देही इलाकों में 8 से 10 लोगों को साफ़ पीने के पानी तक रसाई हासिल नहीं। इस तरह अगर सफाई के हवाले से बात की जाए तो 46% आबादी को रोज़मर्रा इस्तेमाल के लिए पानी मुयस्सर नहीं। इस तरह 29% आबादी ऐसी है जैसे हिफ्ज़ान सेहत के तहत इस्तेमाल होने वाले पानी तक रसाई हासिल नहीं। इन तमाम मसाइल का असर दूसरी SDGs पर भी होता है, जैसे गुर्बत, मनफी मसावात और माहौलियाती तब्दीली। जैसे कि मिस सिमी कमाल ने शुरू में बताया कि अगली कॉन्फ्रेंस में हम माहौलियाती तब्दीली के हवाले से बात करेंगे। तो माहौलियाती तब्दीली की एक बहुत बड़ी वजह तेज़ी से बढ़ती हुई शहरी आबादी है। शहरी आबादी में पानी की तलब भी बढ़ रही है और इसमें ना सिर्फ घरेलू बल्कि सनती और आबपाशी शोबाजात में भी इसकी तलब में इजाफा होगा। लिहाजा हमें इस बात का ख्याल रखना होगा कि पानी की फरहमी तमाम शोबाजात में इंसाफ के साथ हो। और इसके बाद माहौलियाती तब्दीली और इसके एशिया पेंसिलिक खित्ते में मुतवक्का असरात, जिसमें दर्जा हरारत की ज़्यादती, समंदरी चढ़ाव, खुश्क साली और एशियाई मौसमी असरात शामिल हैं। इससे न सिर्फ मईशत बर्बाद हो सकती है बल्कि गुर्बत, ग़िज़ाई क़िल्लत और अवामी सेहत से मुताल्लिक़ मसाइल की भी बहुत बड़ी वजह बन सकती है। सिर्फ कोविड-19 ही नहीं, और भी बहुत सी वजूहात हैं जिनका मैंने अभी जिक्र किया। तो अब इसका हल क्या है? मैं कह रही थी कि इसका कोई हल नहीं है। बहुत से ऐसे अवामिल और अनासिर हैं जिनकी मदद से हम इसका हल निकाल सकते हैं। जहाँ तक मैं समझती हूँ ये काम बग़ैर बहामी ताउन के मुमकिन ही नहीं। जैसे कि आप देख सकते हैं कि ये एक फ्रेमवर्क है जिसके ज़रिए SDG 6 को तेज़ करने में मदद हासिल हो सकती है। सबसे पहले तो हमारे पास एदाद व शुमार होने चाहिए ताकि हम सही तरीके से मसाइल को हल कर सकें। और फिर है सहायता को बढ़ाना, जो कि बहुत अहम नुक्ता है। इस फ्रेमवर्क के जरिए हम कोविड-19 के असरात को बेहतर तरीके से समझ सकते हैं और एसडीजी की कार्रवाई को तेज कर सकते हैं। इसके बाद तमाम अहम किरदारों के साथ ताल्लुक बहुत अहमियत का हामिल है। इस तरह हम मुस्तकबिल में कामयाब हो सकेंगे। बहुत शुक्रिया।
Very pleased to invite Dr. Nida Hussain, Pro Vice Chancellor of Ziauddin University.
Thank you, Danish. So I'm just going to talk about lessons from COVID-19 and how we can use them for advancing the SDG 6 goal. I come from an institution where we are a hospital and a university both. So I'm going to talk about a couple of slides on how we tackled the COVID-19 in our industry. As far as the hospital was concerned, we were obviously in the forefront, and we have multiple campuses all over Karachi, and one of our most renowned faculties with the university is our Faculty of Health Sciences. So what was our response to COVID-19? So immediately SOPs were issued for all campuses, all hospitals. We were monitoring day to day, minute to minute, all the WHO guidelines for lockdown, for outbreak control, for medical health professional guidelines, for patient guidelines. Immediately, we designated a 50-bed COVID ward facility. This was built literally within 7 days. And then it was replicated all over the different campuses of Ziauddin Hospital. And then later on, as soon as the vaccination came, within days, we started our vaccination centers. And especially, like I talked about disparity, we saw the disparity, and efforts were taken to facilitate the vulnerable, including home care services, home COVID testing, as well as online screening, telemedicine. And a lot of our COVID forefront doctors were even doing free consultations for COVID patients online. As far as the education side was concerned, lockdown during COVID, we realized what a serious effect it would have on studies. And there was rapid digitalization of services, online classes, comprehensive online examinations. We developed interactive curriculum, hybrid learning, teachers were trained. All of this was done within weeks. Everything was done within days and weeks. We also realized how important it is to invest in technology and an immersive experience. And we invested in a lot of digitalization during this time. So now what we learned, how we can put this forward to help achieving this goal. So globally, at least 2 billion people use drinking water sources contaminated with feces. Contaminated water can transmit diseases such as diarrhea, cholera, dysentery, typhoid, and polio. Contaminated drinking water is estimated to cause 485,000 diarrheal deaths each year. And here I would also like to add that the very resistant typhoid strain, which was called Typhoid X, was also first discovered in Sindh. And the government did launch a very effective campaign against this multi-drug resistant typhoid. And so we're still dealing with the effects of that. And also the lessons that we learned from the pandemic is that information sharing is important. Immediately as the pandemic hit, platforms of free and open data sharing became accessible around the globe. All the medical information, social information that were usually only for people who subscribe to it, those were immediately available for everyone. Our policy process was suddenly very driven by science. Scientists, doctors became an integral part of any policy making. And that is essential to combat any type of diseases. Different stakeholders developed partnerships between academia, business, civil society, governments. They all came together to find solution. The world spent trillions in a fight against COVID. And like I said, within 1 year, we had 9 vaccines. And I think for SDG 6, perhaps the fear of death will make us spur to action. And I think every institution needs to do a little bit about their part. We have established a sustainability office in Ziauddin for green initiatives. We are implementing renewable energy. We have our solar project, and we have an STP plant for enhancing water availability for slum areas, and other plants. Such plants are planned in Karachi and Sakkar. Extensive plantation drives across the city focus on inclusiveness and gender mainstreaming, environmental monitoring to national data centers. Ziauddin has also organized 2 parallel sessions of the UN SDSN 9th Annual International Conference on Sustainability Development. So in conclusion, I would like to say the 2019 coronavirus outbreak has highlighted the importance of WASH in protecting human health. However, our region faces critical challenges due to scarce water resources, growing populations, and poor public infrastructure. These challenges, coupled with the COVID-19 pandemic, not only impede on the region's progress towards SDG 6, but also cascade onto other interlinked SDG 6, SDGs such as poverty, gender equality, and climate change. We need to learn from our COVID experience and come together as one. And the whole world needs to be on the same page like it was for COVID. And I would like to thank everyone.
मैं बात करना चाहूँगी डॉक्टर ज़ियाउद्दीन हॉस्पिटल की कोविड-19 के दौरान कारकर्दगी और लाए अमल पर। हमारे बहुत से कैंपसेस में, कराची में और हमारे सबसे बेहतरीन इदारों में हमारे हेल्थ साइंस का इदारा है। 2020 में जैसे ही कोविड-19 आया, हमने फ़ौरन ही SOPs जारी कर दी थी। WHO की जारी करदा गाइडलाइंस पर फौरी अमल दरामद किया गया। फौरी तौर पर 50 बिस्तरों पर मुश्तमिल कोविड-19 वार्ड कायम किया गया, जो बाद में दूसरी साइट्स पर भी बनाया गया। ज़ियाउद्दीन हॉस्पिटल ने अपने हेल्थ वर्कर्स, डॉक्टर्स, स्टाफ और तलबा के लिए फौरी वैक्सीनेशन को यकीनी बनाया। कमज़ोर अफराद के लिए घर बैठे टेस्ट, कोविड टेस्ट और वैक्सीनेशन की सहूलत भी पहुंचाई गई। इस तरह तालीम के मैदान में कोविड-19 के बहुत गहरे असरात रहे। ज़ियाउद्दीन यूनिवर्सिटी ने फौरी तौर पर ऑनलाइन क्लासेस, ऑनलाइन इम्तिहानात को यकीनी बनाने के लिए नया सिलेबस जारी किया ताकि तालीम की फौरी फरहमी यकीनी बनाई जा सके। ज़ियाउद्दीन यूनिवर्सिटी ने टेक्नोलॉजी के शोबे की मदद लेते हुए महज चंद दिन में ये तमाम काम सर अंजाम दिए। इस दौरान हमने टेक्नोलॉजी के शोबे में काफ़ी सरमायाकारी की। अब हमने इससे क्या सीखा? तो दुनिया में तकरीबन 2 मिलियन अफराद आलूदा पानी पीने पर मजबूर हैं। आलूदा पानी बहुत सी बीमारियां जैसे कि डायरिया, क्लोरिया, टाइफाइड का बाइस बनता है। एक अंदाजे के मुताबिक डायरिया से सालाना 4,85,000 अमवात होती हैं। सबसे ज़्यादा ख़वातीन और बच्चे आलूदा पानी से मुतासर होते हैं। इसके साथ मैं ये भी बताती चलूँ कि टाइफाइड की सबसे ख़तरनाक किस्म टाइफाइड एक्स भी सबसे पहले सिंध में सामने आई है, जिसके बाद हुकूमत ने टाइफाइड के खिलाफ हिफाजती टीकों की मुहिम का आगाज़ किया था। अब इसके साथ हमने क्या सबक सीखा? इस आलमी वबा से तो डेटा शेयरिंग के लिए मुख्तलिफ प्लेटफॉर्म बनाए गए। मुस्तकबिल में इस तरह की बीमारियों से लड़ने के लिए साइंसी पॉलिसी पर काम किया गया। तालीमी इदारों, कारोबार, सिविल सोसाइटी और हुकूमत के दरमियान इन मसाइल के हल के लिए शराकत दारी कायम की गई। दुनिया ने अरबों खरबों रुपए कोविड-19 के खिलाफ लड़ाई में लगा दिए और 1 साल की कम मुद्दत में हमारे पास कोविड-19 के खिलाफ 9 वैक्सीन मौजूद थीं, क्योंकि मौत का खौफ इंसान को काम करने पर मजबूर कर देता है। और मेरे ख्याल में तमाम इदारों को अपना अपना काम, अपना अपना किरदार अदा करना चाहिए। ज़ियाउद्दीन यूनिवर्सिटी ने ग्रीन इनिशिएटिव्स के बरकरार रखने के लिए दफ्तर कायम किया। MW2 सोलर इलेक्ट्रिसिटी प्रोजेक्ट्स शुरू किए। कच्ची आबादियों में पानी की फरहमी को यकीनी बनाने के लिए ST प्लांट लगवाए गए। इसके अलावा कराची और सक्कर में भी प्लांट्स लगवाने का इरादा है। शहर भर में वसी पैमाने पर शजरकारी मुहिम भी कराई गई। सनती धारे को मरकज बनाया गया। बिग नेशनल डेटा सेंटर के जरिए माहौल का जायजा लिया गया। इसके अलावा ज़ियाउद्दीन यूनिवर्सिटी ने SDSN के SD 9th में 2 सेशन भी मुनक्किद करवाए। तो आखिर में ये कहना चाहूँगी कि कोविड-19 ने हमें हाथ धोने और सफाई के हवाले से बहुत गहरी आगाही दी है, लेकिन हमारे खित्ते में यहाँ बहुत सी मुश्किलात का सामना किया है, जिसकी वजह से पानी की शदीद किल्लत, बढ़ती हुई आबादी और ख़राब बुनियादी ढांचा है। ये तमाम मसाइल कोविड-19 के साथ मिलकर न सिर्फ हमारे खित्ते पर असरअंदाज हुए, बल्कि गुर्बत, सनती मसावात और माहौलियाती तब्दीली जैसे मसाइल में भी इजाफे का बाइस बने। हमें अपने कोविड-19 में हासिल किए गए तजुर्बों से सीखना चाहिए। متحد ہو کر آگے بڑھنا چاہیے اور میں سب کا شکریہ ادا کرنا چاہوں گی.